On Primetime Politics tonight, the Minister of Defense taps a former Supreme Court justice to do another review of sexual misconduct in the military, with the promise to finally establish an independent reporting system. The Minister of Defense will be here to explain why it's taking so long to bring meaningful change to the culture inside Canada's military. As MPs debate a timetable for faster COVID vaccinations, a key group on the front lines, nurses, say tougher measures are needed now to prevent the third wave from totally overwhelming the healthcare system. And our panel of party commentators weighs in on the top issues of the day. But we'll begin tonight with the latest effort by the federal government to crack down on the culture of sexual misconduct in the Canadian military. The government has called on former Supreme Court Justice Louise Arbour to conduct another review of the military with the aim of establishing an independent reporting system outside the military chain of command. And while the government is waiting for the findings of that review, it's creating a new internal D&D Office of Professional Conduct and Culture, headed by one of the military's highest-ranking female officers. The move comes as the government faces continuing questions about its handling of the allegations of sexual misconduct against the former Chief of the Defence Staff, General Jonathan Vance. And as new case numbers reveal just how badly efforts to stamp out misconduct in the military have failed. Well, joining me now is the Minister of National Defence, Harjit Sajjan. Minister Sajjan, thanks for taking time to speak with me today. Appreciate it. Let me start by asking you why you think we need another study to figure out how to set up an independent reporting system for members of the military who want to report allegations of sexual misconduct.
First of all, I just want to say the reason this is we need to do this is we need to make sure that we rebuild the confidence for our survivors who have come forward. Clearly, we need to rebuild the confidence with them to making sure that we have a proper structure in place. And what this external review is, it's much broader than the work that was done in the past. It's about setting up a structure, the exact mechanisms that are going to be needed to making sure that not only the survivors can be heard and listened to, but also actions can be taken to hold perpetrators to account. That's independent right. of the chain of command and also the national defense.
But you talked about the work that's been done in the past. It was extensive work from the federal government already has a landmark report from another Supreme Court Justice, Marie Deschamps, in 2015, and she recommended at the time the creation of an independent body outside of the military to deal with complaints of misconduct. Instead, your government okayed the establishment of Operation Honor and a civilian-run reporting center inside the chain of command. That's largely been ridiculed from inside and outside of the ranks of the military. And in the past 5 years, since Operation Honor's been in place, there have been more than 581 reports of sexual assault. So I guess, why are you not announcing today this new independent outside reporting body instead of another study?
Well, first of all, it is important to get this right. The work that was done by Madame Deschamps was extremely important to get the work started. What we're doing right now is to go even broader, to making sure that Madame Arbour can actually dig deep, go broad as possible, to making sure that we actually create the structure in place that's going to create and provide that confidence, independent of the chain of command and national defense, and look at what that body was going to look like. What we had and put what was in place after Madame Deschamps clearly has not worked, and this is one of the reasons why we need to change that. Okay.
Let me ask, I guess you said today that you've learned this system you have in place now. You just said it didn't work. But she already found it didn't work, Madame Deschamps, in her report in 2015. That was the time to make the change to an independent body. That's what she said. So you're admitting today that not implementing that key recommendation that she made to government at the time was a mistake and a failure. Is that correct?
So the work that was done to create the independence when it came to SMRC, that work was being done to make it more independent. What I'm saying there is that work did not go far enough. And what we're doing right now is actually creating an external body. Plus, also, got to make sure this is not just about reporting we're looking at. We're looking at what structures are going to be needed. For example, what type of legal support will a survivor need coming forward? How does the NIS or the military police connect into the system? There could be legal changes that we might need to make, regulation changes. But the important part of this is making sure that we have a system in place that actually works by listening to our survivors. And clearly, in the last few months, we have not gotten this right, and we do need to do better.
But why, Minister, why isn't that system in place today?
I wish that we could have gotten this right, but clearly this has not worked.
Okay, so if you had your druthers now looking back, the right way to go would have been an independent reporting system, and at the time, you chose not to go that route, and that's what I'm asking. You're saying now that was a mistake.
No, the route that was taken clearly was not the right one, based on now what we have absolutely learned and the survivors that have come forward and who have shared their stories. This is why we need to take a much more broader and bold approach. And one of the things here we're also looking at, not just when survivors come forward, we're looking at the prevention piece. We're looking at how leaders are selected, how the promotion system is also done, plus giving greater latitude for Madam Abur to go further. We're also putting mechanisms in place immediately with the organization that Lieutenant General Carrion will also be leading.
But again, all of this is happening in the context of 5 years now where things haven't got better, they've gotten worse in the military. And that's been an acknowledgement that the culture hasn't changed. And I mean, people are listening to this today, I'm sure, within the military and saying, all right, here we have another study when we had this opportunity 5 years ago to say this, independent reporting outside the chain, this is how we're going to do it, but your government chose not to do it.
No, we are taking very strong action. In fact, when we came in as a government, one of the first things that we did after the defense policy review, we put our people as number one as chapter number one. Within that, started implementing Madame Deschamps' recommendations into the defense policy itself when it comes to GBA plus analysis that needs to be done. A lot of the work has been ongoing. Good work has been done in some cases, but also obviously this is not enough. And one of the things is we need to be even far bolder. And that's what this review is about, is to making sure that we get it right for the survivors. Okay. And the actions will be bold and sorry, go on.
But that's an acknowledgement, I'm assuming here, that they could have been bolder 5 years ago. You should have been bolder.
Absolutely.
The boldness you're talking about now would have been handy to have 5 years ago.
When you had those conversations, like when you look in hindsight, absolutely. Okay. One of the things that I wish we could always be able to look back and be able to get it right. One of the things that we're trying to do right now, and you're absolutely right, when we talk to our members saying, here we're doing another study, no. What we wanted to do here is when we looked at this is making sure we give confidence to our folks. So we're not going to be just waiting for a report. One of the key aspects of this is that any interim recommendations will be acted upon. And also, Madam will be able to work with us to making sure that it's set up properly as well.
Can I get a little clarity here on exactly what you're after? Justice Arbour will be looking at the military justice system as well. So you want to create an independent reporting body outside the military. Does that also include an independent investigative body? Who will investigate the complaints brought forward to this outside reporting body? Because that's important to a lot of people.
Absolutely. And that's what exactly will also be looked at. That's why it's going to be very broad in terms of her scope to take a look at. And I don't want to just say this is what I think it should be. She will do that work, but yes, it will look at that. And we're going to go even further. So when we talk about how leaders are selected, for example, the performance evaluation, we want to look at which levels do we need to have even greater scrutiny when, for example, having 360 interviews that are independent, unit environmental surveys as well. All those are going to be taken a look at. Do
you think it's time to have an outside investigations organization to look into these complaints in the military? Because there are critics of the National Investigation Service, which is made up of military police. There are reports just today of a private Facebook page for military police where comments have been posted mocking the woman at the center of the allegations against General Vance. Do you believe military police and the National Investigation Service can be trusted to take allegations of misconduct seriously?
Well, first of all, I haven't seen those, but that is absolutely extremely disappointing and disturbing. But this is exactly what Madam Arbour will be looking at, and she has the tremendous experience to look at exactly what type of structure.
But you're the Minister of National Defense. You're involved in these conversations all the time. What you're hearing from people about the trust factor for the National Investigation Service and the military police, and victims saying that they haven't been taken seriously, in some cases victims being mocked. Do you think there needs to be investigation done outside the chain of command and outside the military?
And as I stated, this is exactly what Madam Arbour will be looking into. These are the same concerns that I have as well, having somebody with the right expertise to take a look at it, making sure that a right process is in place. And we have to get this right. Whatever process we put into place, we can't just say we have an external body, it's going to work. We need to make sure that it's properly tested. Obviously, from what we have heard in the past few months, this has not worked. And so this is one thing that I am absolutely certain and committed to making sure that when we look at this, is we want to be able to stress test it as well, but also put greater support with also greater emphasis on how do we look at preventing these situations from happening in the first place.
All right, Minister Sajjan, good to talk to you again. Thanks for your time tonight.
Likewise, thank you.
Well, now to the latest on the pandemic third wave in Canada. Ontario announcing today it hopes to make vaccine appointments for all adults by the end of May. Quebec says it will be taking vaccine appointments for all adults by mid-May. Federal officials say that's thanks to the ramp-up in vaccine supply coming to Canada in coming weeks.
If you look at what we have received to date and distributed, which is approximately 15 million doses, since we started in December. What you will see between now and the first week of June is about the same amount. So it's a significant increase in provinces and territories, vaccines that arrive on schedule, at a pace, and provinces are now able to plan better, with more certainty, with more confidence, their immunization plans, and the same with the territories that have been receiving a steady flow of vaccines.
In the House of Commons today, MPs debated a motion from the Conservatives calling on the federal government to ensure every Canadian adult has access to a COVID-19 vaccine by the May long weekend. Conservative leader Aaron O'Toole was asked how he expects the Trudeau government to make that happen.
Well, yesterday, President Biden talked about the arsenal of vaccines that the United States has on reserve that could be used for allies and friends. We are their NORAD, NATO, long-standing neighbors, allies, trade partners. Our economies are directly integrated. We need the Prime Minister to fight for those vaccines so that we can help move past this health crisis and economic crisis.
Well, now to the front lines of the COVID battle and an urgent call for governments to take more drastic steps to counter the third wave as the healthcare system in some provinces is being overwhelmed. And when we say the system, we really mean people in the system, those frontline workers. They make the system run. Vicky McKenna is a registered nurse and the president of the Ontario Nurses Association, and she is with me now. Vicky McKenna, thanks for taking time to speak with me today. Give me a sense of what's happening to nurses who've assumed so much of the burden of caring for the growing numbers of COVID patients in hospital. What's happening with them?
Well, absolutely they have, and it's been such a long period of time to be working at the intensity that they are and in the situations that they are. So here in Ontario, and I think most people, watching the news certainly know this, is particularly right now in our hospital system, which has been taxed all the way through these numbers of months, is in overcapacity. And, so many patients who are so desperately ill. And they are, I'll just say, they're exhausted. They're physically and mentally exhausted, but they are doing the very best they can in the situation that we're all in. But aside from that, what they tell me is that they feel that, it's hard for them to see the light at the end of the tunnel. And it's very difficult right now. Ontario
is said to be close now to enacting the triage protocols to decide who gets intensive care treatment when it's needed and who doesn't, because there are too many patients to treat at any single time. How close are we to seeing that in Ontario?
Well, I hear various reports from the field about this, and some of the ways the hospitals are dealing with it is because of capacity. They're trying to open more beds so they can admit more people or transfer people across, and they are transferring people across the province in order to build capacity. No one wants to be in a situation of triage protocols. We hope we never get there, but I do hear, and I've heard some of the physicians speaking particularly on the media and at various meetings, that they're worried. They're worried that we may be reaching that point. ICU admissions continue to grow, And right now, it's precarious, I would say, for everyone.
And people need to make the link, right, between when they open tent hospitals, satellite hospitals, they open more beds. There need to be frontline professionals to deal with those patients, right? And that's the big strain.
That is the huge strain. And what the nurses are telling me is that, you know, in normal, whatever, almost everyone forgets what that was, is that they would have a certain number of patients they'd be expected to care for, and particularly in our ICUs would be one-on-one or 2 patients max. But I will say that it's well beyond that. Opening extra beds is not giving us more staff, and that is really critical. Absolutely.
What more do you expect governments to do to ease this strain?
Well, certainly, you know, some of the measures that have been put in place, I think, are helping to alleviate some of that. And I already mentioned around moving patients around. We're hearing about redeployment of nurses from other institutions and from other sectors within healthcare into the hospitals. There's a number of things that are happening, but you know, it isn't adequate yet. You know, we're not at a point where we could take a deep breath and say, okay, we're there. We're not there. And there's a lot of movement happening. Certainly, you know, even calling out to other provinces and other countries, apparently they're doing that. But what's happening right now on the ground, the relief isn't there yet. But redeployment is happening. But it's a really uncomfortable situation for nurses to come from an area, a sector where they've never been, and coming in and doing, you know, they're doing the best they can with what they have.
Let me ask you
the skills they bring.
Yeah, let me ask you a little bit more about that. We know Ontario is getting help from the military, as is Nova Scotia.
Right.
Ontario is getting, as you mentioned, a few extra healthcare workers at this point from Newfoundland and Labrador. Other provinces may be able to step up, but how realistic is it to believe that other provinces will be able to provide a whole lot to Ontario?
Well, I've been on national calls with nursing leaders across the country, talking just about that and what capacity level they're at. We're not alone in the situation here in Ontario, but ours is what I believe to be the worst. However, the others are building and worry about, you know, sending people and then really needing them back. So it'll be a careful balance. It'll be decisions that need to be made in those provinces, whether they can actually release people to come and then still be able to hold the fort back in their home province.
Let me finish on this. You know, a lot of people have talked about the need for a better paid sick leave offering in a number of different provinces. Ontario sort of in the headlines these days. What difference will 3 days of paid sick leave make to help curb the spread, do you think?
Well, first off, it's not enough. I mean, we've heard from leading healthcare professionals, physicians, epidemiologists, even the science table here in Ontario talking about, you know, looking for 10. And the reason they're looking for 10 is that's the basic isolation period when someone's been forced off work. And or if someone's been diagnosed as being positive COVID. We have to stem the flow. We have to stop the cases. We have to bring the numbers down. And many, many people are forced to go to work. And they can't afford not to. They are the sole provider for their families. So 3 days is a start, but, you know, in the long run, will it actually make an impact? I don't know. But we need to, yes, get people vaccinated, but we also have to allow them to care for themselves and their families. And even for nurses, there's many nurses who have not been eligible for any sick pay because they don't have those benefits in their collective agreement or their contract.
Right.
When they're put off work, they're off work without pay. And it's such a muddle of different programs really out there right now. It needs to be simple. This one is they don't have to apply, which will make a difference, I think, for people. Employers will then be reimbursed. But it's a start.
All right. Well, thanks so much for giving us your perspective, and to you and your colleagues, stay safe, and know that a lot of people, everybody appreciates the work you're doing on the front lines. Thank you so much.
Well, thank you very much, and everyone do that. Please stay safe and follow the protocol. Thank you.
Time now to welcome our panel of political commentators. This week I'm joined by Susan Smith, who's a Liberal commentator, Tim Powers, a Conservative commentator, and Kiavash Najafi is an NDP commentator. Good as always to see you all. Thanks for being here. Susan, let me start with you with the news that paid sick leave finally coming to Ontario after months of delays and wrangling with the federal government. Look, we tell workers to stay home if they're sick. That's the messaging from all the experts and governments. And now we have governments. So I guess my question is, how have governments, plural, handled this issue so crucial to trying to beat back the pandemic and save lives?
Yeah, not that well, I think, on the whole, Peter. We know that sick days are a provincial jurisdiction. The feds put something in place. There is a safety net of, I think it's, I'm going to get the stats wrong. Someone will have them right. But there is a safety net from, I think it's 5 days, the federal government. But you have to apply after the fact, and that's complicated and cumbersome for people, but it's there. But more immediate measures, I think, were needed in the context of COVID. The provinces have all been reluctant to put something in place. Ontario's, until this week, was outright refusing to consider it. They finally put something in place. To me, it's a fairly simple solution that they put in place, but it's only 3 days and you can only take one at a time. But it finally is giving a bit of a backstop for people who have to miss a shift or miss a day because they need a test, they need to isolate, or they need to go get their shots. But on the whole, botched by government.
Tim, what are your thoughts on that and then how governments have handled sick leave?
Well, the pandemic, policymaking during the pandemic, Peter, has been a work in progress, whether it be in sick leave, employment benefits. This is another case in point with the Ontario sick leave. Other provinces are looking at it. It's just lessons to be learned from all of this about future pandemics and how we go forward with it and how this stuff gets prioritized in non-pandemic times. Look, what Ontario's done is better than nothing, but is that the bar we want to achieve? What Canada's done is better than nothing, but again, is that the bar we want to set? So some low bars that need likely to be raised as we go through hopefully to the end of this pandemic.
Kiavash, what do you think of how governments have handled all this, especially in the context of the messaging from the beginning of the pandemic, really? If you don't feel well, stay home. But, clearly looking at the take-up on some of these programs, workers have said, yeah, I wish I could. You're not making it easy, though.
Yeah, Doug Ford is vaccinated. He tested negative to a potential exposure, and he's taken 10 days of sick leave already. I don't know how he believes that somebody who might test positive could get away with only 3 days of paid sick leave. This policy is too late. It's too little. It should not be paid by the public. I understand some support for small businesses during the pandemic, but I don't understand why we have to pay for Amazon, one of the richest companies in the world, not paying its minimum wage workers a day off to take care of themselves. All of that to say, I'm glad something is happening. I think this just highlights, as Tim said, a lot of the problems we're experiencing with the pandemic has nothing to do with health. It has to do with a social system that is not supporting workers.
Part of the debate here, right? Part of the debate is who foots the bill and whether it should be, as you touched on, Kiavash, whether it's up to small business in many cases, some big businesses too, but small businesses to carry the freight on this, and this notion of permanency, right? Is it there once you put it in, it's hard to take out if you're a small business that can't afford the extra cost. But, Susan, where we are, people are saying, okay, this is a step forward, but, if we don't see the take-up on it, this part fails too.
I think we up on it if it hasn't been complicated. People have needed it. You're right. It is a challenge for small business to have this kind of thing in place, but I do think a sunset clause is valuable in the context of a pandemic. We have to, Tim is right, policies on the fly, made on the fly during a pandemic, we don't always get it right, and tweaking it is important. And I do think it's okay for things to be sunsetted. The CERB's going to be sunsetted, other things are going to be sunsetted. So if we can't get it right 100% at the beginning, put a sunset clause in it, that's fine. I do think, though, that the province of Ontario has been tone deaf. I'm sure the folks who think of how to do these things have had the idea ready and waiting to go in a folder. It was just a question of finally the Premier and his cabinet saying, fine, we'll do something about it. And fine, they're doing something about it. It's not great. It's there. They'll hopefully help.
Tim, again, the big question is, okay, if people aren't convinced this is enough to I know that's the question. I mean, do you think this is enough to make people who are sick say, okay, I can afford to stay home now?
Well, there's another part of the question too, Peter, and I suspect Susan's living this, and Kiavash as well. Look, good companies are already, particularly ones that are of a certain size, are already providing sick leave benefits for their employees. They're already looking after them. I mean, again, the danger here is looking at it just as solely being a government responsibility here. If Ontario's wish, as I understood it when it was announced earlier this week, is that their 3 days will then be supplemented by a deal they're trying to strike with the federal government on a top up to an existing policy. Well, that's better. Maybe this takes the trajectory of SERVE, Peter, that when it was first introduced, there were problems, but it ultimately became a very useful vehicle for people. Hopefully that's the case, but 3 days isn't enough. So maybe their plan is, as I say, to hop along with the feds and add the extra 7 working days that would make it a reasonable sick leave policy.
Just quickly on this, Kiavash, do you agree with the notion of sunsetting it, saying, look, this is a pandemic program, and I guess we'll reignite the whole permanent sick leave debate after the pandemic's over?
If it was different, I would agree with sunsetting it. For instance, I think that maybe we could have 15 days 3 weeks of paid sick leave that is fully paid by government, and it sunsets at the end of September when hopefully we all have been vaccinated. That would make sense. But this policy doesn't make sense. It's too little, it's too late, and the sunsetting of it doesn't make sense. And I agree with him. Ultimately, the best way and the most progressive way to do this work is that it would become a condition of labor in Canada, that everybody has access to sick leave. It's paid by employers. And if employers need support, that can be dealt with, but I don't believe Amazon needs our support.
Okay, just a couple of minutes left, so fairly quick answers from all of you on this. But Susan, let me start with you. Minister of Defense has announced yet another review of military misconduct, sexual misconduct by yet another former Supreme Court justice. Is that what's needed now?
I think this one's different, Peter. It is a review, but it's a review with action attached to it, and it's a mandate to create something outside the system. The last review resulted in op honor, and there was resistance about creating something outside the system. Former Supreme Court Justice and former UN High Commissioner for Refugees, Louise Arbour, has been mandated to advise on the creation of an external entity that's outside the chain of command of the military for people to report. That's a good thing. The other thing that I think is important is there's a lieutenant general who's been put in charge of implementing any recommendations that come up along the way. This isn't a review and stuff at the very end. This is a review with things to happen and action along the way.
Tim, how do you see this? A lot of people thought the last review by Justice Deschamps was pretty clear. Its number one recommendation or key recommendation was set up an outside reporting system. How do you see this?
Well, maybe there's some review necessary on the specifics of what happened with General Vance and Admiral MacDonald, but I think, as you just alluded to, Peter, the Deschamps review gave a lot of prescriptive direction as to what needed to be done. And I think if you're in the Canadian military, particularly a female serving officer, or female serving member, but not exclusively female serving members, you want action. You're sick of words. You want action so that the culture can try to change. Maybe some things did happen with Operation Honor, but clearly not enough. Action is necessary, not more reviews.
All right, Kiavash, let me hear from you to end our conversation today.
Yeah, I agree with what I've just heard. It's time for action rather than another review. I have a lot of confidence in former Justice Arbour, but I do believe that it's time for action. And I think that this minister has lasted so long in his position because he has gained the confidence of the top brass of military through his inaction. He's gained their support by not doing anything. It's time to actually do something.
All right. Thank you all for your time. We'll talk again. Take care, everybody.
Thank you.
Thank you.
And that's all the time we have for this edition of Primetime Politics. I'm Peter Van Dusen from all of us here at CPAC. Thanks for watching. We'll see you next time.